I thought what would be useful to start though is just to spend 2 minutes talking a little bit about Sure Trust, because we have undergone probably the biggest period of change that we've had in our 30-year history over the last kind of 12 months. We've recently grown the organisation to become one of the top 20 largest charities in the UK. And we've done that firstly through some organic growth, but in the main through some acquisitions. So we now have the Sure Trust Group, which incorporates Sure Trust, as everybody hopefully knows, the Prospects Group, Ixion and Sure Education Trust, along with a whole range of other smaller organisations that we're now trying to bring together, and collaboration actually being the theme of my little slot today. We focus on 7 specific areas, all to do with supporting people to transform their lives in lots of different ways. So employability is one of our big areas, and we run kind of large-scale national contracts, so work and health programme, which I'll talk to you about in a little moment, new enterprise allowance, national career service, specialist employability support, and we're currently running down work programme and work choice across all of our CPAs as well. But we also have 6 other distinct areas, and they all have to work together for the benefit of the organisation, our beneficiaries, our partners and our commissioners. We have a justice division. We're the largest provider of HMPPS CFO3, fantastic title, largest provider of those contracts nationally. We have an education division, so in addition to Sure Education Trust, we also have Gabatas and Optimus, both organisations operating internationally around education consultancy for people at disadvantage. We have a learning and skills division, and we are now one of the largest providers of apprenticeship and traineeship and foundation learning programmes across England. Children and family services, so this is a new part of Sure Trust's operations. A lot of people don't know we actually run 26 children's homes across the UK and have fostering and adoption contracts across a number of local authorities. Health, we deliver a range of health and wellbeing contracts, including BBO in London, specifically for people with mental health issues. And finally, our social impact division, which covers everything from enterprise, our retail charity shops, of which there are around 100 dotted about the country, our accessibility services, and importantly, the work that we do internationally, because we have operations in no less now than 11 countries around the world and are working with the governments of those countries to support people at real disadvantage in all of the different operational strands that I've mentioned. So, our purpose as an organisation now, just recently relaunched our values and our purpose, but ultimately what we want to do is transform the lives of 1 million people a year. Pretty ambitious statement. And we'll do that here at home through running a number of different contracts for a number of different commissioners, but also on that international work that we're doing across. And I wanted to talk to you very quickly about a little piece of that work. So we are working in partnership with a social enterprise in India and an engineer who's actually designed a wheelchair that can be manufactured, really cheap unit cost, and manufactured by people sitting down. So we've employed a number of wheelchair users in the factory to produce these wheelchairs, which will then be given for free to other people who require wheelchairs. And that's one example of the international kind of social enterprise projects that we are currently doing. So work and health programme, very quickly, that's where we deliver. Central England, home counties, West London. And we really wanted to focus on 2 aspects of the programme. The first is around service integration, and the second is around localism. Now, service integration, the term is nothing new. And I remember running a customer focus group back in the days of New Deal. And I spoke to a customer who said that their biggest issue with our sector was that we don't talk to each other. And they had an appointment with their, what we now call work coaches, they would have been called something else back then at Job Centre Plus, an appointment with their housing officer, an appointment with their probation officer, all at the same time on the same day, and nobody would cancel or rearrange for them. So they were in a really difficult position. Do I go back to prison? Do I lose my house? Or do I have my benefits stopped? And when you hear that, you think, wouldn't it be great if somebody just picked up a phone or sent an email and said, I'm working with this person, can you reschedule or can I reschedule the appointment? But you know, in a lot of cases that didn't happen. So work and health programme is really designed with service integration in mind. And it says at the bottom there, holistic person-centred approach. That's not the approach of Sure Trust as a provider. That's now the approach of the commissioner. And I think that little change is actually really important, because the commissioner is now saying you have to work with housing associations, with healthcare providers, with specialist providers, in order to ensure that that participant gets the very best level of joined up service possible, and reduce the duplication of services as well. So very quickly touching on our delivery model, because this will provide some context for the collaboration piece. So we've created a number of work and wellbeing hubs. We have done this really to provide a space for the local communities to come and deliver their services for free, and for people to have a space to access lots of different things as well. So they're very bright, they're airy, they're not the kind of, offices with training rooms and computer suites. We've got all of that there, but it's more like a coffee shop feel. And so there's always fresh fruit available for people. We have lots of different activities, everything from arts and crafts, sports, yoga, tai chi, a whole range. I think when we last looked at the Leicester hub, there were 46 different sessions running over the course of 1 week. So really it's all about giving customers choice. We know that the greater the choice, the greater level of engagement that we have from people. So we've also put in place health and wellbeing teams. These are specialists. We've got general practitioners, experts in musculoskeletal, psychotherapists, physiotherapists, a whole range of different clinician experts. We also have a volunteer programme and currently have over 1,000 volunteers working across our contracts, and they donated 100,000 hours of their time last year to support our customers on a range of different things. And I wanted to talk a bit about time credits as well, because this really helped us with the whole service integration piece. So we are working in partnership with Tempo. For those of you that have not heard of Tempo, they used to be called Spice Innovations. No great surprise they decided to change their name. And Tempo are managing our time credits initiative. Time banking, of course, nothing new. It was around in the 80s. But this is slightly different. So for every hour that one of our customers volunteers to do something that helps their community, and that could be running a local reading group in the library, it could be a local walking group, whatever it is, they receive an hour's time credit back, and they can spend that in the local swimming pool for an hour's swimming, or the local gym for an hour's exercise, or they can save them up and take the kids down to London in the summer holidays and go to the Tower of London or Madame Tussauds or whatever. It's a really great way of building people's confidence and self-esteem, but also delivering that social impact as well on a local level. And on that, we've decided to change the way with Work and Health programme that we approach everything really. And to start with that, I'll talk a little bit about the way that we've approached our responsibilities as a prime contractor. For a long time now, and every organisation is different, but certainly I've worked with a number of primes over the last 15 years, and some of them have a kind of command and control attitude towards contracting, and we wanted to get away from that and build more of a partnership. And also, critically, the expert organisations that we work with, that all of us work with day to day, for the benefit of our beneficiaries, customers, participants, service users, whatever we want to call the people that we're here to help. Those niche providers very often have cash flow issues, they're small, they may be third sector, they don't know where the money's coming in to pay the bills very often. And so we felt that the right thing to do was to commission those experts and pay them up front for a number of interventions. And if we don't use those interventions, that's our problem. We'll then gift them to our end-to-end supply chain partners or to other partners or Job Centre Plus. But ultimately, those small organisations, they're able to forecast more effectively, and we can then help them to capacity build as well, moving forward. When I was looking at putting a slide together that illustrated localism and working in partnership, I had a little look on our MI system to see how many organisations we're working with across the work and health, just the work and health programme areas that I showed you earlier. 1,246 separate organisations are invested with us in the work and health programme. Now, we don't contract a lot of those. We don't commission their services because they are already commissioned through other avenues. But actually, it's building those relationships at a local level. It's going out and meeting. I think I've met with about 50 MPs now across the different constituencies to talk about what their view of the world is. It's talking to combined authorities, local authorities, devolved deal areas, and really getting into the grassroots of what's happening locally. And when we were setting this up, we were looking for co-location and outreach opportunities, because we've got the work and wellbeing hubs, but we can't have them everywhere. And so we've got over 600 sites that we deliver services now that are co-location and outreach. Co-location, things like children's centres, community centres, health centres, so on and so forth. But our outreach, it could be the local library. It could be absolutely anywhere. And so I went to have a look at a potential co-location site in Birmingham, South Birmingham. And I found an organisation. I'm from Birmingham, I'm a Brummie. I didn't even know this organisation existed. And it's called Northfield Community Partnership. And within this little office on the high street of Northfield, tucked away in South Birmingham, next to a Kentucky Fried Chicken, if anyone's into that, they deliver so many different services to the local community. So they deliver housing services, financial support, support for people who are victims of domestic abuse. They're a food bank, they're a needle exchange. They've got so many services being run from this place that it just seemed right that we would co-locate with them rather than the other options that we had in that particular area. But I would never have known they existed had we not embarked on this kind of journey to try and find as many organisations that had, you know, synergy with our values and wanted to support people in their local community. And it's given us so many opportunities. There are challenges, of course, and we've heard a lot about the challenges today, and I could list on 30 slides some of the challenges that we're facing. But actually, what for me is exciting is that with every challenge that we face, it somehow seems to be turning into a further opportunity or something that we hadn't considered before. So, for example, expanding caseworking with local authorities and NHS. We're now seeing more and more case conferencing happening. We're seeing, you know, 2, 3, 4, 5-way conversations through WebEx, through video link, or through good old-fashioned conference call between service providers for the benefit of an individual. We're talking about joint commissioning now with combined authorities, local authorities, with CCGs, with housing associations, and that real integration is starting to come to the fore, and now able to align the development of service delivery as well. So, talked about building capacity with organisations. We're really in a position now where we can springboard to, I think, the next level of trying to shape the way that governments procure services. And actually that's a really exciting piece of work that we'll be working on or continuing to work on next year. So I just wanted to give you a flavour really of our experiences on the Work and Health programme, particularly around service integration and localism, and our intent to work with as many organisations as possible in as many ways as possible to really change the way that public services are delivered. Thanks very much.